Hello, everyone. This is Betsy Wurzel, your host of Chatting with Betsy on Passionate World Talk Radio, where our mantra is to educate, enlighten, and entertain. The views of the guest may not represent the host or the station. Folks, before I introduce my guest and the topic, today is September 11th, 9/11, and I just want to take a moment to say we should never forget this day. I live in New Jersey. New Jersey was greatly affected by 9/11, and we should always remember the brave men and women who died, those who died saving people, and those who are still dying from the illnesses, from the toxic fumes that they inhaled while clearing out Ground Zero. We should always honor this day. And that's what I have to say about 9/11. And also, this is September, and it is Suicide Prevention Month. If you are in a crisis, please, if you are in the U.S., call 988 and seek your primary care physician for resources in whatever area you live in. And it is also World Alzheimer's Awareness Month. And please learn about Alzheimer's. It is the number 6 killer. It is a global epidemic. And sooner or later, unfortunately, you will know someone who is affected by this disease because it affects 1 in every 3 people. And yes, you can get Alzheimer's young. And that's my public service announcement for today. With me today, I am so excited, folks, because you know if you listen to me talk, if you listen to my shows, you know I'm a huge mental health advocate, huge. And if you are in the work environment, if you are in management, leadership, even if you are a worker, this show is for you. How many people are in a toxic work environment? What do you do about it? Well, you're going to want to listen to my guest today. My guest today is Marnie Dobson Zimmerman, who is a Ph.D. She is currently Associate Director of the Center for Social Epidemiology in Los Angeles, California, and she is Campaign Director of Healthy Work Campaign. And folks, I'm going to tell you this. I went on the healthywork.org website. I'm excited. This is a tremendous resource, and I encourage everyone to go on this website because if you want to know how to have a positive work environment, if you want to take the survey, if you want to know anything about a healthy work environment, I highly recommend you go on healthywork.org. The link will be in the blog. But I want to welcome today Marnie Dobson Zimmerman. Welcome, Marnie.
Thanks so much, Betsy. Thanks for having me. I'm delighted to be here.
Oh, you are welcome. It is my pleasure. I was so excited when I received the press release about your Healthy Work .org and your Healthy Work campaign, which I forgot to mention is a project of the Center of Social Epidemiology. How did this get started, Marnie? And did you create it by yourself or with someone else? And what motivated you to start this wonderful campaign?
Well, thanks, Betsy. It's nice to hear, you're being excited about the campaign and the message you're trying to send. You know, I'm not alone. I have a small team of folks that we all work together. I started off in social epidemiology and public health with my colleague and friend, Dr. Peter Schnall. And Peter is the director of the Center for Social Epidemiology, which is a nonprofit research foundation that he started in 1988. So the center has been around for a very long time, and its mission was really to bring together the scientific research that has been collected for almost 30 to 40 years now, closer to 40 years now, on the impact of work stress on health. So particularly for Peter, he was really interested in how these different kinds of workplaces and work environments caused stress, which then led to higher blood pressure. So he's done a lot of research on looking at the impacts of really high job demands and low job control, which are two elements of the workplace that we're all exposed to in various jobs. And he found, and many people have found in repeated scientific studies, that this kind of work increases blood pressure and can lead to hypertension and cardiovascular disease. So the center has really been about collecting the science of work stress and disseminating it. So what we realized around 2018, as we continued to do our research within the universities, is that we wanted this message to get out to a much broader audience than just us scientists who, we were kind of speaking to the choir. And so that's when we conceptualized the Healthy Work campaign, because we really wanted to raise awareness among the general public, among working people, among leaders in organizations, among government and policymakers, really just, heighten the awareness overall of the impacts of work stress on health. So the Healthy Work campaign, we launched the website that you were so excited about, which really is a translation of the science that we know from all those years of research, and really kind of explaining to people that stress is not just in your head, that it's part of the work environment itself, and that it's one thing to be able to impact the stress going on in your body and your mind by taking meditation classes or doing mindfulness, which are really important, but it's another thing to try to prevent the stress by creating healthier work environments. So that
absolutely.
Really was our impetus, yeah.
Yes, it makes such a big difference, Marnie, and I'm sure the audience can relate who have had an experience bullying in the workplace, added stress in the workplace. And I just have to say, you know what? My pastor used to say, everything rises and falls on leadership. And it is so important for people who are in management. If you're a CEO and you're listening to the show, you're in management, I highly recommend you contacting Marnie, going on the website, because we need to have a positive environment where we work, because it can cause stress. It can lead to suicide even. And, people think, oh, well, no, that can't happen. Oh, yes, it can. It can happen.
Unfortunately, it does, yeah.
Yes.
We've had, some recent research that has shown the impact of these kinds of stressful work environments. Obviously, that they can contribute to poor mental health, increase the risk for depression or burnout and then depression. And from that, obviously there's a higher risk for suicide among people who are depressed. So we know that, unfortunately, work is a contributor then to suicide. And we have something like 800,000 suicides in the world every year. So it's a major issue. And, of course, among younger people, it's increasing as well, which is very sad. And we need to understand more about why that's happening.
Exactly. And does the Healthy Work campaign, if someone is a CEO or a management and they wanted their company to be involved with this, what do they have to do, Marnie? Do you give courses?
Yeah, we do. We have a lot of resources on our website, including webinars and workshops that we've given that kind of describe the way in which organizations can go about really understanding what the stressors are in the work environment. Because we really do believe that the first step to change is identifying the problems, and really to identify the issues around stress it's really important to talk to your workers, talk to employees and working people. And of course, that's easier said than done in really large companies, and even in small companies, because people often, will feel like their information may not be confidential, or that they may be retaliated against for complaining about something in the work environment that might not be working as well as it could. So I think it's really important to try to have leaders understand that this information is really valuable, but should be collected anonymously from working people so that they can feel, safe and confident sharing their experiences with stress and or issues in the work environment that, may be difficult to talk to a direct supervisor about or to management about. We still, unfortunately, in this day and age, have retaliation against people who report discriminatory activities or bullying in the workplace. So one of the first things we really suggest, and one of the things that we've offered on our website, is this online tool we call the Healthy Work Survey. And it's available to organizations big and small, and we've had a lot of interest in a lot of organizations that have used it. It's completely anonymous, it's completely online, and it's completely free. So it's a service that we provide to organizations that are really invested in trying to change the culture of their workplace, to try to get at the hidden problems that they may not even know about in the upper management level. It gives you some data to start understanding where the problems are in order to be able to change them. So basically on our website we have, a link for employers and for individuals and for unions to click on and request access to the survey. And then we respond, usually within, a couple of days, and, connect with a representative and send a unique link. And that link is sent out just to that organization's employees. The employees finish the survey. We always try and get about 60% of people participating at least. And then we produce a free automated report for the organization, usually within 24 to 48 hours. So the report is also free, and it really does allow organizations to kind of see where they are relative to the U.S. population. So, for example, a major stressor that can really affect people's health and well-being is workload and job demand.
Yes.
So obviously sometimes when people are overloaded, they, are not as productive as they could be. Workload is a major stressor, especially when it's unreasonable. You're not getting enough breaks from work. You're not getting enough recovery time. It goes often together with long hours or weekend work. And that kind of impact can lead to burnout on people. And, of course, when people are burnt out, they're not as engaged. They're not going to be as productive at work. So, it really is a way of understanding where the problems are and how to correct it. And it is really looking at the work processes that might be leading to issues that affect people's well-being. And, the survey is a starting point, for organizations to begin to look at that. And also for individuals, because we have the survey available to any individual that wants to take it. And they also can get a free report. It's completely anonymous and confidential. And it will give them a sense of what their stressors are, what their risk for stress is relative to the U.S. population. So we compare scores on the level of social support they feel they have at work, or the level of safety that they feel like they have at work, the level of work-family balance. We measure all these major elements of what we know are stressful working conditions.
Yes. Oh, my goodness. This is such a wonderful resource, folks. Now you see why I was so excited. When you go on the website, you'll know why I was excited. Workload. There's nurses in New Jersey just went on strike because of workload, unsafe patient ratios. And that's been for years and years.
Yeah,
the nurses
it's
are
a major
speaking up.
issue Yeah, for nurses. And throughout the country, you know, there have been some nurse-patient staffing ratio laws passed in various states. I think in California was the first one here after nurses organized and really pushed for these laws, because in doing that, you know, you're protecting patient safety, because, you know, as you said, a lot of these nurses are oftentimes understaffed in these major hospital systems, and, you know, there's just not enough nurses to, for example, lift patients safely, which can lead to musculoskeletal injuries, accidents, and then overwork. You know, mandatory overtime can lead to fatigue, and nurses and doctors, for that matter, can make mistakes. You know, there are increased patient safety issues. There's been research done on this when, you know, these healthcare workers are overworked.
Yes, definitely. Yeah. And especially during COVID, where they really suffered. And yes, I'm going to say suffered, folks, because when you're a doctor, you're a nurse, and you second guess yourself, you take your work home with you. And during that time when, you know, they faced so many deaths that they weren't used to, that it was just really not good for their mental health. And I'm really glad that we're talking about it. And, you know, I know, you know, as physicians, it's that good old boy network. Even though there's female physicians, it's still that attitude of, you know, suck it up. You know what the job, you know, was about. But I'm hoping that's changing. And when people have these conversations, Marnie, the more people have conversations about it, I hope it will be better for the doctors and nurses to be able to get the help that they need. They should not be penalized at all for going for mental health care, therapy,
absolutely. And, you know,
counseling.
I think it's so important to make sure those resources are available to physicians and nurses. I mean, obviously, when you're overworked and burnt out, it's really hard to practice self-care, you know, and I think that creates a cycle, you know, where people continue to get sicker and sicker until, you know, it can get to a point. We have really high suicide rates among physicians. And unfortunately, since COVID, I think, while COVID was obviously an historical anomaly, an event that we hope we don't see again for at least another 100 years. But it did really highlight problems that existed in the healthcare system even before COVID, and that are still existing, and giving rise to, you know, 1 in 5 physicians saying that they are going to retire or quit because of these experiences that have led to burnout among physicians and nurses, especially after COVID, or, you know, as the pandemic was winding down. We had a lot of nurses leave the profession because, and you know, that's continued. So it's leading to even more understaffing in these hospitals and overwork. So, you know, it really is a crisis that we attend to the mental health of our healthcare workers by creating healthier work environments. You know, and I know the hospital, you know, leadership and managers are you know, focusing on bringing that care to people. However, it can't be at the cost of the care providers. As you know well, people have to be healthy and able to be able to do their job.
Exactly.
So, you know, it's a tough one. And the U.S. Surgeon General during COVID released a report on healthcare worker burnout, which is, I would encourage folks to look into. The U.S. Surgeon General has been doing some really great work since COVID on highlighting the mental health issues that occur as a result of work. And, you know, he released the 5 essentials of workplace mental health. And he talks about these important aspects of work that should be focused on by organizational leadership, including, protection from harm, the importance of connection and community. He's been talking a lot about loneliness recently, which is something we should talk about as well. Work-life harmony, the ability to balance work and home life. Mattering at work, which is a huge one. Feeling the respect and dignity of being treated well and treated with respect, including being paid adequately, right? And
yes,
I think this one is it's a big one. Opportunity for growth, which, we know from our scientific research that people who learn new things on the job and who, are not in a boring, mundane job where they do the same thing every day, but they have some variety, or they get to advance or get acknowledgement, that those things are so important for mental well-being of working people.
Absolutely.
So he's doing a great job. Yeah.
That is excellent to hear that they're talking, more about it, because there's nothing worse, folks, and I've experienced this myself, of being bullied at work and being disrespected. And for anybody in leadership, shame on you if you were in leadership and somebody comes to you thinking that they're going to talk to you in a confident way, that you're going to help them, and then you go blab it to all your coworkers and embarrass that person. Shame on you as a leader. If you did that and you're a leader, director, CEO, I don't care who you are, that is so improper, not professional at all. And I have seen it, Marnie. I have seen people do that. And especially, I worked in a preschool that was very small, and if the director had a problem with somebody, she'd tell everybody. Everybody. The problem.
That's just another way of shaming and humiliating people, which, shuts down the ability to listen to, the people that you work with and to hear what the problems are so they can be addressed. So leadership is definitely positive leadership that, models healthy communication, that doesn't tolerate disrespect and incivility, and let alone discrimination and bullying or sexual harassment. We've had such an awakening, I think, in our culture since the Me Too movement, to the reality that leadership sometimes abuses its power. People abuse their positions, and it's not acceptable. It's not acceptable anymore. And I think the important thing for other leaders, if there's hopefully more than one leader that can, be accountable for their organizational culture, is to hold each other to account, to create and live by a mission statement, as many of these organizations do. They have these mission statements that, value respect and dignity and well-being at work, but if it's not implemented, if it's not applied and enforced, then these mission statements don't mean anything. So it really is about living the talk, and I think there's not enough being done by upper management and leadership in many companies right now to adjust, the culture and to really not tolerate toxic workplaces anymore. More needs to be
that's
done,
true.
Sure.
Yes, and with people working more at home during COVID. And now they're having a problem. These companies, I hear it on the news all the time, these people don't want to come into the office. They want to be at home, maybe because they worked in a toxic work environment, maybe because they could be at home with their kids or, an aging parent. I think, Marnie, the whole work environment needs to be restructured, especially as baby boomers age, and I'm one of them. Where they might be caring for their spouse or their parent, maybe even a child, and they need more flexibility. So I think the old 5-day-a-week, 9 to 5, which is from way back when, it needs to be modified. And I think it will be eventually modified. And I think that, I think that everyone, maybe this is the hippie in me, Marnie, I don't know, but I think that everyone should want to work in a nice, positive work environment. I don't mean the fake positive, but in an environment where you support each other and you care about each other instead of, talking about someone. When I was caregiving for my husband, would you believe somebody reported me to the director because I ordered out. Yes, because I had no time to cook. Now, why is that anyone's business anyway? So instead of, the director should have said, you know what, that's really none of your business. What anyone does after work, whether they order out or they cook. So instead of people understanding the situation, my husband didn't cook, my son doesn't cook, I can't come home and wait an hour.
I don't cook.
And I love to cook, but I wasn't able to.
Yeah.
How about saying to someone, Betsy, or whoever the person's name is, I see you're stressed. Can I help you with something? Is there a way I could help you? Maybe find a resource for you? Instead of bad-mouthing the person and shaming them. I think there's a lot of that goes on, or shaming someone because they go for counseling. That, folks, is just not acceptable to me at all. And, yes, I get on my soapbox, and I'm really passionate about that because no one has a right to judge anyone who goes for mental health care because you don't know what life has in store for you. And what curveball you might be thrown, right? So you might end up needing someone to talk to. And it's really, I think the workplace, Marnie, especially dealing with, and COVID, a lot of people died during COVID. And even if it's not COVID, if a coworker loses a parent, a child, or spouse, how is it handled in the workplace? And I think a lot of training, sensitive training maybe, should go into that. How do you handle that in the workplace? Because it's very awkward. Extremely, I felt very awkward.
It can be, unfortunately, we still have stigma attached to, to grief, to mental health conditions, and sometimes people, who don't know how to communicate in positive ways can, say things that are very hurtful and or, on purpose try to hurt people or put them down because there's a competitiveness or a competitive environment that's fostered in the workplace. There's always going to be personality differences. Unfortunately, I think some personalities have been rewarded more than others in terms of, people who are, more cutthroat maybe and more determined to climb the ladder, putting other people down as they go. That kind of culture in a workplace leads to kind of stigmatizing weakness. So I sort of see this as whether it's if someone's grieving a parent or you have a mental health challenge or there's some kind of stressful bullying situation going on in the workplace, all of that needs to be addressed in the same way. And that's why we talk about healthy work, because ultimately a healthy workplace is going to create a safe environment for people who are grieving, because there's going to be policies and training put in place so that leadership knows that this is going to happen potentially to everyone at some point. You're going to lose a loved one and be at work, and how do you deal with that? Women and men who have become parents, the same, there's obviously not the stigma attached versus someone who's having a mental health crisis or a dependency issue. But, the same impacts at work. People need to be given resources need to be recognized, need to feel safe, being able to come forward and say, hey, I need help, or I need an adjustment to my schedule, or I need more time off, and that has to be created by, leadership creating policies and practices, and then training supervisors and managers in how to implement those practices and policies when they're in place. And, it's not going to be perfect, but I think there are processes that can be followed so that people don't have such a toxic experience when they're going through a loss, or they're going through, they're going through a mental health crisis, that they're given support by, within the workplace, that they're not seen as weak, which I think is part of our culture still.
Yes.
I think that when we're sick, we're somehow not good enough. We're not the robot worker that we're supposed to be. But everyone can have something happen, get sick, whether it's physical or mental. And I think we need to create work environments where it's possible for people to have flexibility when they experience some kind of life event or trauma, without, ending up losing their job or having to leave their job.
Absolutely.
Yeah.
Yes, absolutely, Marnie. I mean, I think of CEOs and upper management, middle management, whatever anyone wants to call themselves, if they set up a healthy work environment, they would have happy workers, healthier workers, and it would make for a more productive staff and a happier workplace. So I think that, people need to really get on the ball. And I know that a lot of management is still probably men. I'm not bashing men at all. But, men are brought up as young boys. You don't show your emotion. If you do, you're weak. That has to change on how we raise our boys. And, it just goes on. And especially if you're a middle management person is of a certain age where they grew up that way, it's difficult for sometimes for people to change. But I am all for a healthy work environment. It really, when someone has a challenge at home and then they have a challenge at work, it is very, very stressful. And it's not good for that person. And I know that from experience. It's not. It leads a person to depression. It does.
It really can. Unfortunately, we do know that these factors at work lead to depression and burnout. One of the really important things is I remember someone talking about stress, and why do people keep talking about stress? Stress is just go take a deep breath, or get up and stretch, or practice mindfulness, which is fine in the short term. But if you're walking into an environment where your workload is out of control, where your supervisor or middle management is stressed as well, because they're being put, because sometimes middle management is also in between getting pushed from above to get these, deadlines, to hit these deadlines to get these projects out the door. And so oftentimes in these surveys, middle management can be some of the most stressed people because they're dealing with really high workload and high job demands. And, of course, the people that they're managing may not realize that. And they're being taught to, obviously perform and not show that they're stressed because they're being evaluated for their performance and their productivity. So I think what we're looking at is a change to the culture that understands that human beings are not always going to be top performers all the time. And creating an environment that acknowledges that as human beings, there's a limit to how much we can do and take on, and especially if we have, outside, issues going on, like, loss of a loved one or a divorce or having a child. or taking care of an elderly person or a loved one who has, a chronic illness. All of those factors, need to be built in, because at some point everyone is going to experience something like that. And so we have to create a culture that has, greater ability to be flexible, that is a safe place, or there's safe avenues for people to explain that they have these things going on and they need accommodation. And
yes.
there's ways of doing that. And there are workplaces that are successful at doing that.
Yes, there are. My son, who has a cognitive disability, he works for a local school bus company. I won't mention the name, but they were so good, Marnie, during my husband's illness. Like Josh, they couldn't do the Family Leave Act. So they let Josh work in the morning, be off in the afternoon, without penalizing him. They were so understanding. It was really awesome, and they love my son. He's a good worker. He's been there now 17 years, I think. Yeah, 17 years
great.
already, or 16. And they hire a lot of people with disabilities, and I told Josh, I said, I'm jealous. He likes when I say that, because for holidays they give them little things. At the beginning of the year, they give them like a lottery ticket, a little snack bag, just showing appreciation for your employees. I said, I didn't get anything.
A lot of people don't. Unfortunately, I think acknowledgement and respect and acknowledgement of doing a good job, I think, is so important to people.
Yes.
But of course, it's also, about acknowledging when, things might be going awry, and people are being overloaded at times, or, even in a small organization we've worked with the Healthy Work Campaign. I won't name names, but, they're a nonprofit who are very committed to helping the people that they serve. And oftentimes this happens in small nonprofits where individual working people are deeply committed to making a difference and helping others and serving the community, oftentimes do too much to their own detriment, and people start burning out. They can't sustain the level of work that's required, and also because the nonprofit has limited resources, they're not able to hire enough people to take on the workload. And in this instance, even in a small organization, they were able to utilize the Healthy Work Campaign's resources. They used the survey, and they identified that these issues were going on, that people were leaving because it was too much. They couldn't keep up with all the work. They were having very high rates of burnout and depression. And so they decided to do something about it, and maybe because they're a small organization, they're more nimble. But I think whether you are a small organization and you have a commitment, or a huge multinational corporation with, lots of resources, that could be brought to bear on creating a healthier workplace or workplaces, it is possible to make change. And it doesn't have to be a return on investment issue, because ultimately when people are burnt out and leaving your organization, whether large or small, that is costing them. It's costing these organizations and having to retrain and rehire people.
Yes.
So, you are losing from the bottom line. I mean, not only is it a moral thing to do to create, a workplace that promotes and doesn't at least, damage mental health. But, it's also really important to understand that not attending to the impacts of sources of stress at work can lead to, losses in good quality staff and in productivity for those staff that are remaining. And that is costing by some estimates, $300 billion a year in the U.S. So, we know that there are high costs to work stress that, if ignored, companies are shouldering those hidden costs themselves. So making things, better, will may be saving them in the long run.
That's very, very true. A healthy work environment is better for, everyone. And now that, the workforce is getting, I would say less because people aren't having as many children, so there's not as many workers. Companies need to be accommodating to people and to create the best work environment. No place is perfect, folks. We know that. But to make it as comfortable and productive as possible, it benefits everyone. And Marnie, I love talking to you. I could talk to you for hours. You are wonderful.
Fantastic. Thanks for having me. I've got a million different things we could talk about.
Yes, and you know what? I would even love to have you back because I just thought of it, like to discuss how the U.S. is compared to European countries.
Oh,
that's a great topic.
Started on that.
Yeah.
There's a lot of good things going on in Europe in terms of dealing with these, what we call psychosocial, stress and psychosocial hazards that we can learn about here in the U.S.
Yes. I enjoy talking to you, and I know that they can take the Healthy Work survey at the healthywork.org website.
Yes.
Marnie, is that's
right.
Correct? Okay.
Healthywork.org,
and, folks, I'm telling you, I'm not just saying this. I'm not getting no kickback from Marnie or her company. I'm telling you, this
We're not
website.
Because everything's free.
Yes. this made me cough, made me laugh. This website, is phenomenal. You have to go on there and take a look. If you're in management, I don't care your company, you're self-employed, you're a worker, there's nothing to lose. It's free. Just go on the website, take the survey, and see what is on there and see what's available with courses and to help your employees, to help yourself, to help have a better, positive work environment. I can't stress that enough. I really can't. I am going to really promote you on my LinkedIn page, if you don't mind.
I'm going to do Thanks, Betsy. Yeah.
You're welcome. I'm going to do a post about that because I think it is just so important, especially now. People are in crisis. People are having a difficult time. Let's make the workplace easy. I don't mean easy work, but as pleasant. Let me put it that way. As pleasant as possible. It benefits everyone. And Marnie, I can't thank you and your what you're doing and the work that the center is doing. The Center for Social Epidemiology is doing to help other people. Thank you.
Thanks,
from the bottom of my heart.
It's a pleasure. It's been a pleasure, and I'm happy to chat anytime. It's been very lovely talking to you.
Oh, thank you so much. My pleasure. Folks, you heard Marnie Dobson Zimmerman, and information on how you can take the survey and the website will be in the blog that Jeannie White, who's station manager, writes. Please read the blog. I'm telling you, and I don't care if I sound redundant because I am so excited about this campaign. It's much needed. It helps people. That's what I'm here for. I am here to help people have a better life. I am here to provide resources I sure wish I knew about, because I'll tell you what, I could have used to have taken this survey 5 years ago, if not longer. My employer definitely could have used this for sure, a couple of them. And I just think that, this is what Chatting with Betsy is about, folks. It's about helping people. And And I want to thank everyone for listening and subscribing. And if you don't already subscribe to Chatting with Betsy, it is for free. I am on iHeart, YouTube, Spotify, Spreaker, to name just a few. And please share this show because I want to help as many people as possible, and I need everyone's help to do it. So please share the show so I can help others and help as many people as possible. Maybe you know someone who's having a difficult time in the workplace. Maybe you yourself are having a difficult time in the workplace. Check out healthywork.org, and I think you'll be very satisfied. And I also want to thank Lillian Caldwell, who's CEO of Passionate World Talk Radio, who makes this all possible. And I have to say, because it is almost middle of September, I'm celebrating 4 years chatting with Betsy on Passionate World Talk Radio. And I want to thank everybody, thank Lillian Caldwell and Jeannie White for giving me the opportunity. I feel blessed, folks. I am grateful. I am doing this to give back, not only to help myself, but to help others, because that's what I'm here for. I'm here to serve, and that's what I'm about. And if you want to follow me, I am on Facebook, Betsy, Betsy, E. Wurzel, Wurzel, and I am also on LinkedIn. And again, I want to thank everyone for listening. I get passionate. I am passionate. I am passionate about mental health care. I certainly am. There's nothing worse, folks, and I know from firsthand experience, to walk into a toxic work environment. Okay? People literally get sick from it. It does affect their health. Let's work together to have a healthy workplace. It's so important for everyone. And that's what I have to say. And as I always say at the end of my show, in a world where you could be anything, so please be kind and shine your light bright. Because if we were all kind and shine brightly, we would have a positive work environment, and the world would be much better. So that's what I have to say. Thank you for listening. This is Betsy Wurzel, your host of Chatting with Betsy on Passionate World Talk Radio. Chat with you soon. Bye-bye.